Coming from both traditional healthcare and technology sectors, I believe that AI assisted diagnosis and remote monitoring will become a standard practice. Once a doctor starts studying, they have to study lifelong because they have to keep themselves updated. Either you come in a like technical field or in business field like me, or you stay back in your core clinical. You have to be updated with the new inventions, with the new technology, with the new drugs. If you will not do it, you will lag behind, and then you will find one day that people and your colleagues are far ahead of you, and you are just not able to do good. So, for giving the better justice for your patients, to give them the current medication, to give them the right medication, what is going on with the right invention at the current scenario.
Welcome to Vibrant Publishers podcast. Joining us today is Dr. Rashmi, who is a medical care quality lead at Amazon. With a strong background and expertise in maternity and child health, business development, and corporate strategy, she's passionate about leveraging technology to enhance patient care, improve healthcare efficiency, and create solutions that make a meaningful impact on people's lives. Welcome to the podcast, Dr. Rashmi.
Thank you, Nakul. Thank you so very much for the nice introduction. And I am very fortunate to be here tonight.
Great. Our topic for today is future of healthcare, how technology is redefining patient care. I want to start off by asking you what inspired you in the journey of healthcare technology.
Yeah, so the inspiration actually, the my journey into healthcare technology evolved naturally from my medical background and experiences managing healthcare centers back in India. So
Hmm.
basically, when I was with Indian government and working with Indian government and Indian Navy, so I was managing the office work also, and I was seeing that how the patient care is provided, not only just by clinical solution, but how I can provide better care for them when we are looking to provide by the administration or by the devices and all. So that was with the government. But when was working in an Indian Navy, I built a whole medical facility from a scratch for 500 people. And that time I passed on the tenders, made SOPs. So that time I procured from a pipette to ambulance, and I hired nurses, doctors, technician without having any medical knowledge. So sorry, not medical, technical and business knowledge. So that time I realized that if doctors are having a technical knowledge and a business knowledge, we can create a huge impact. So that is
Hmm.
why I joined MBA in USA at Kelly School of Business. And this is not the MBA which usually doctors does. I did the whole full-time MBA, which along with all CFAs, lawyers, like those people. So I studied finance, marketing, everything in very deep dive way. And then I understood that how I can actually use this that study into the medical part. So after that, I saw immense potential for technology to improve patient care. And that actually I realized coming in Amazon that I can expand access to healthcare service. And that lead me to education and business and technology.
Okay, thank you for sharing that. That's quite inspiring. Now, I would like to ask, how would you describe the current role of technology in patient care?
Yeah, so being a medical care quality lead, I am not just seeing patients or doing clinical work at Amazon. My main work is to strategize the clinical care or to use the technology for their care. So basically, technology is fundamentally transforming healthcare through automated systems. What we are doing in Amazon, so we are enhancing their diagnosis, their data analysis, and from my experience I have seen implementing right technology framework which can significantly improve healthcare delivery. Either we talk about the privacy regulation or we talk about the administrative process. We are focusing on patient care, but that thing has been done by automation. So there is no data lag. there is no like any error chances, which is very less. So currently technology plays a crucial role in patient care by enhancing diagnostic and improving treatment plan.
Right. Uh, I had one question in my mind. You've already done an MBBS, right?
Yep.
And that itself is a very long journey. And then deciding to do MBA, how did you keep that motivation to keep studying for such a long time? Maybe it could help out our audience to, get that motivation.
Yeah, so I did my MBBS from Chandigarh, and after that, I did my post graduation in maternity and child healthcare from Jaipur, and after that, I did MBA. So
Wow.
almost 15 years of studies, kind of, I must
Oh
say.
my God.
Yeah, but uh, what I will say in that, once a doctor starts studying, they have to study lifelong because they have to
Hmm.
keep themselves updated. Either you come in a like technical field or in business field like me, or you stay back in your core clinical. You have to be updated with the new inventions, with the new technology, with the new drugs. If you will not do it, you will lag behind, and then you will find one day that people and your colleagues are far ahead of you, and you are just not able to do good. So for giving the better justice for your patients, to give them the current medication, to give them the right medication what is going on with the right invention at the current scenario, you have to be
Hmm.
updated.
Right. Moving on, my next question is, what do you think are some of the major problems in healthcare that technology is solving now?
That's a very good question, I must say that. So working in both traditional medical setting and technology driven environment, I have observed technology addressing few key challenges. So the first is improving access to care through telemedicine, because I have worked in telemedicine while COVID, and I was the first few doctors who joined telemedicine when it was just new coming. And I worked them for a year. I was doing really good over there. I led and like help and inspired many doctors over there that time. And then
Hmm.
another, like enhancing diagnostic accuracy with AI and machine learning. So right now, if we see MRI and all those imaging techniques are become more advanced because we are using AI. So there is very less chance of having any errors. Another thing which I will say, the streamlining the administrative process. So like the electronic medical record system, ERP, which we'll say, it is like a very beneficial. Instead of writing by yourself, we are having an electronic medical record. So there is no or very less chance of errors. Another thing I will say, that enabling better patient monitoring and preventing care, because when everything is downloaded in your data or in your setup in a computer, you know what prevention treatment you are giving to your patient. And the same
Right.
time, with the right treatment, you can actually plan if there is any consequences later. You can actually forecast that.
Hmm. Right. Interesting. And what about AI and data-driven tools? How do you think they're changing the way doctors and patients themselves interact?
So, in my current role, we are leveraging AI and data analytics to transform healthcare delivery. In Amazon,
Okay.
I am dealing with 1 million Amazon employees who is working
Hmm.
in warehouses and FCs, and we are analyzing large data set. We are making sure that we do not have any workplace injury, which is going to harm them a lot. We are trying to like reduce that by the help of the AI. We are leveraging AI and data analytics to make better decision making and improve the outcome for the injuries or any mishappenings. So the key is like maintaining the human element. Like if I would not be there to analyze the AI and technology, we cannot do that anything. But so it is a very fine balance between the human element and technological benefit, which actually we can help in assisting in more accurate and faster diagnosis, providing more personalized treatment plans, and streamlining administrative tasks, as I said. And one of the very important which I have found, like enhancing decision making with data backed insights. Because when we have a data, it's very fast and right way to make decisions about the treatment plans.
Hmm. Right. Right. And what's your opinion or perspective on wearable devices?
So, my perspective is like, having worked in both rural and urban healthcare settings, I have seen how wearable home monitoring can bridge healthcare gaps. So, basically, these technologies are particularly powerful when integrated with existing healthcare systems supported by proper medical oversight. Because when you are wearing like a watch, which is giving your blood sugar or your heart rate, you are getting a real time data, and
Hmm.
when you are getting a real time data, you can manage very proactively any crisis because you know what is happening. Like, I'll just give you one example. One of my patient, she was having a low glucose issue. Before
Hmm.
even having that watch, which was like monitoring her for the low glucose and a low heart rate, she got faint in a public place, and
Hmm.
people were trying to do like, as in India, like chappal sugana and all those, like they are trying to, okay, mirgi to nahi hai, epilepsy to nahi hai. But
Yeah.
when we suggested, okay, there is a technology, if you can get a device, you can actually wear all the time, you will get to know yourself. Okay, now the device is beeping, it's the right time that you should eat something, you should not forget. And when the nearby people of that person also knows, okay, that device is beeping, we need to make sure that she is eating. So
Hmm.
that is the kind of awareness which comes with the wearable devices. And it is like very facilitating for the remote monitoring of like healthcare providers too, because we get to know, okay, what is happening, we can see that when is a fluctuation in the reading, what she's eating, when she's eating, how the glucose is monitored, how the heart rate is monitored. So I'm saying that it is very good, especially for the elderlies, it is very good.
Right. How affordable is this technology?
So it depends on company to company, device to device. Like, I cannot say that, okay, this is very affordable or this is not very affordable. It actually depends on like which company device you are looking for. And right now, many players are in the market which is having those kind of devices.
Moving on to my next question. Let's talk a bit about empathy and how do you think healthcare innovation balances the efficiency that it's providing along with empathy?
So one would very good thing I'll tell you about my personal experience. The first day of my MBBS in Chandigarh,
Hmm.
we first year was taken to an assembly hall, or you can say an auditorium, where we all students were standing, and our dean said the first thing you need to remember to become a good doctor is to have empathy. The day you will lose that, you are not a good doctor. So
Hmm.
for me, empathy is the biggest thing, and that was the thing which made me very successful in my career, and especially while COVID, when I was doing telemedicine, because people were very scared that time that how a doctor will take care of us or cure us on like a phone call or a video call.
Hmm.
But that time, leading with empathy, like listen to them, what is their problem, don't be in a rush to provide a treatment, just listen to a person what they are trying to tell you. Because half of the problem of the patient resolves when a doctor listen to them, because the first thing comes like nobody's there to
No, that
listen their
makes
pain.
sense.
So when you are listening to them, you are actually resolving their first pain, that nobody's there to listen to them, and then you are coming on their disease. So I will say I have learned that successful healthcare innovation must balance a right empathy and to use technology to enhance but not replace human interaction.
Yeah, that's right. That's right. Got it. Now, you must have uh, come across a lot of resistance with healthcare transformation. Maybe when dealing with, uh, say, rural parts of the country, there might have been resistance with technological involvement in healthcare. Have you observed any challenges like this when you're trying to implement new technologies?
Yes. So I'll say one thing that, especially in India, we are not early adopters,
Hmm.
because early adopters are like, oh, like, fine, we got a new technology, let's try that. But in India,
Right.
our mindset is like, let it run. Let's see how
Hmm.
this goes. Uska result kya aata hai? We will get to know then. What is the result? Then only people like, oh, Ambani used it fine because that person has so much of money. But
Yeah.
when the next door neighbor is using it, then you realize, oh, that neighbor is having actually a good benefit. So in India, we are not early adopters. So that is the biggest problem for having any AI tool or like wearable devices. But what I see is a future game changer, because AI driven diagnostics are giving you predictive analytics, which is very good for like maintaining a course for like acute diseases, chronic diseases, or genetic diseases
Hmm.
nowadays, because we are having so many things that our DNA is developing super fast, and AI is like supporting those predictive analysis in preventive care like anything. Be it personalized medical based genetic profiling, personalized medical platform impact, which is like reduce healthcare cost, improve patient outcomes, enhance preventive care, better resolution.
Right. Right. So the the point here is that we have to be ready to experiment with things.
Yes, we have to be
Uh,
open, not experiment. We have to be
okay.
open for the new ideology, new technology.
Okay. And trust the healthcare professionals.
Exactly.
Got it. Now, let's talk about the business side. What role do you think business strategy plays in making healthcare tech successful?
Uh, Very good question. And in last 6 months, I have been reached out around like 50 to 60 doctors that how we can come into business strategy, because
Hmm.
now people are seeing that being a doctor doesn't mean that you only do the clinical changes or like clinical practice. You can come in the business, you can come in the technology, and still can have that empathy and can lead the clinical practice. So my business education and healthcare experience have taught me that successful healthcare technology requires both clinical expertise and sound business strategy. If you do any short courses of like 6 months courses and all from coming from the clinical background, for me, I think so, it's my opinion that that will not cut through, because we doctors, especially in India, we don't study finance, we don't study marketing, we don't study technology. So for us, we have to study from the core.
Hmm.
So it's about creating a scalable sustainable solution for, especially for the clinical peoples to come in the business strategy. And when we are doing it, like, there is lot of innovation which we can do actually, like developing effective implementation strategies focusing on like scalability and sustainability, and develop a go to market strategy if anybody wants to start their own business like a hospital administration, any pharma company. If you know your go to market strategy from your previous experience of being a clinician, you can actually invest in the future, so that will give you a strong ROI.
Right. Right. Makes sense. And combining two knowledge, like your knowledge of medical as well as business, creates something new. As in, uh, one person knowing both of these things can create a larger impact than two people, collaborating. I think you provide new perspectives from the knowledge that you've got. So yeah, I think you would suggest specializing. You would suggest doing an MBA after MBBS, right?
I'll say that do MBA not immediately after MBA. Practice for some time. Have your clinical backup. That will
Hmm.
help you to understand the empathy part, the human emotion. Because if you have not practiced for like few years, you will be just like a person who studied the books but don't know how to work around.
Right, right. Got it. Now, my last question to you is an interesting one. I would like to ask you about the future of healthcare technology. 10 years from now, what is the technology that we can expect, and your predictions?
You're saying so healthcare in 2035?
Yes.
Healthcare is changing every second, literally every second. So whatever I will predict right now, I'm not sure is gonna be in 2035. But what I think that should be there and what can be is like I envision a highly interacted and interactive and
Hmm.
integrated. Remember that, not only
Okay.
integrated, interactive and integrated and predictive and personalized healthcare system where you
Hmm.
can actually have your personalized interactive treatment for person yourself. And
Okay.
apart from that, coming from both traditional healthcare and technology sectors, I believe that AI assisted diagnosis and remote monitoring will become a standard. AI assisted diagnostics, like all the diagnostic technologies like MRIs, your blood pressure, your like glucose, like all the diagnostic tests,
Hmm. Okay.
that and the remote monitoring will become standard practice. The remote monitoring is like having the wearable devices that is monitoring for you.
Hmm.
So that will become a standard practice, and that will give you a right data to analyze and give a personalized treatment, which is actually looking ahead. I will say virtual consultation will become more as a standard practice. People will like value their time more, or instead of traveling and going one to one, they will like to have a virtual consultation. And on virtual consultation, when you have your own like readings ahead in front of you, you can actually discuss with the doctor, these are my past 6 months or 6 weeks reading, and according I think, what is your suggestion of plan? So you can actually get a personalized treatment plan according to a automated health assistants, which is like a
Right.
seamless integration for me.
Right. Makes sense. What about Neuralink?
Neurolink, I think it will take time.
Right. And definitely take time to get introduced in India.
Yes.
Uh, I think the trials have already started, but do you think that could have a good impact on medical side of the the medical side?
Yeah, as I said, like for Neurolink kind of procedure, you have to be early adopter.
Right. Right.
If you are ready to adopt it, it will give you a good benefit.
Sorry, if you could repeat.
I'm saying if a patient is ready to adopt the technology, it can
Hmm.
provide a very good result.
Right. Got it. Well, thank you so much, Dr. Rashmi, for joining the podcast. Got to learn a lot of new things, and really excited for the healthcare technology and what it has in store for us for the future. And we hope to have you once again on the podcast. Maybe by then we'll have new things in the healthcare sector that you'll share with us. So once again, thank you so much.
Thank you. I really appreciate for having me on the podcast. It means a lot. Have a good day.